The parts of Medicare. Medicare is a federal health insurance program for people who are 65 or older, disabled persons under age 65 and certain younger individuals with end-stage renal disease. It also provides coverage to some children up to the age of 18 through Medicaid. The parts of Medicare include Part A, hospital insurance; Part B, medical insurance benefits; Part C, supplementary health coverage; and Part D, prescription drug benefit program. Should I sign up for medical insurance, Part B? If your income is below certain limits, you may be eligible to sign up for Medicare Part B. If you have any questions, please contact us. What is the difference between Medicare and Medicaid? Medicaid is an assistance program funded jointly between federal government and states. Special Enrollment Period, SEP. You might need to take advantage of NSEP if you had no medical insurance when you turned 65, you lost employer group health insurance because of job loss or retirement, or you moved into a new area where there is little or no local provider network. In these cases, you'll get special permission to join Medicare right away without paying any premiums. The first 60 days of coverage won't count against your waiting periods. How to apply online for just Medicare. Parts A and B? You can use this link to get started applying for just Medicare Parts A and B. The process takes about 15 minutes. Once you've completed the application form, click Continue to proceed to payment options. After completing the payment section, you'll receive an email confirmation stating whether you qualified for free credit reports. To see if you qualify for free credit report service, read our article How Do Free Credit Reports Work? What is my eligible monthly premium? Already enrolled in Medicare. If you have Medicare, you can get information and services online. Find out how to manage your benefits if you are enrolled in Medicare Part A and you want to enroll in Part B. Please complete Form CMS 40B, Application for Enrollment in Medicare, Part B, Medical Insurance. If you are applying for Medicare Part B due to a loss of employment or group health coverage, you will also need to complete Form CMS-L 564, Request for Employment Information. You can use one of the following options to submit your enrollment request under the Special Enrollment Period. Go to Apply Online for Medicare Part B during a Special Enrollment Period, and complete CMS 40B and CMS-L 564. Then upload your evidence of group health plan or large group health plan. Fax or mail your CMS 40B CMS-L 564 and secondary evidence to your local Social Security office. See list of secondary evidence below. Note: when completing the forms CMS 40B and CMS-L 564 state, "I want Part B coverage to begin, MYY," in the remarks section of the CMS 40B form or online application. If possible, your employer should complete Section B. If your employer is unable to complete Section B, please complete that portion as best as you can on behalf of your employer without your employer's signature and submit one of the following forms of secondary evidence. Income tax form that shows health insurance premiums paid. W-2s reflecting pre-tax medical contributions. Pay stubs that reflect health insurance premium deductions. Health insurance cards with a policy effective date. Explanations of benefits paid by the GHP or LGHP. Statements or receipts that reflect payment of health insurance premiums. You'll have original Medicare, Part A and Part B, unless you make another choice. You can decide to add a drug plan, Part D, or buy a Medigap policy to help pay for costs that original Medicare doesn't cover. You can choose to join a Medicare Advantage plan, Part C, and get all your Medicare coverage, including drugs and extra benefits like vision, hearing, dental, and more, bundled together in one plan. Source: SSA.gov. What happens after I apply? Find out how to manage your benefits if you are enrolled in Medicare Part A and you want to enroll in Part B. Please complete Form CMS 40B, Application for Enrollment in Medicare, Part B. If you are applying for Medicare Part B due to a loss of employment or group health coverage, You will also need to complete Form CMSL 564, Request for Employment Information. Go to Apply Online for Medicare Part B during a special enrollment period, and complete CMS 40B and CMSL 564. Fax or mail your CMS 40B CMSL 564 and secondary evidence to your local Social Security office. What happens after I apply? After you've applied, we may contact you about additional documents needed to process your claim. We may ask you to provide copies of certain records from your doctor or hospital. These include bills showing what was covered by your current healthcare plan, any other relevant paperwork related to your condition, and proof of income if you're self-employed. We review your claims file after it has been processed. This includes reviewing your eligibility based on the information provided during the application process. CMS News. Healthcare.gov. HHS Office of the Assistant Secretary for Planning and Evaluation. National Quality Forum. Quality Measures. The National Committee to Preserve Social Security and Medicare. Office of Inspector General. Patient Safety Organization. Public Health Service Commission Corps. U.S. Department of Veterans Affairs. Veterans Benefits Administration. CMS program websites for beneficiaries. Medicaid Program Integrity Toolkit. A toolkit designed by HHS, Office of Inspector General to help states identify fraud or abuse within their Medicaid programs. The toolkit provides a list of questions to ask when reviewing claims submitted through state Medicaid agencies. HHS Caregiver Support Portal provides tools and resources for caregivers who need assistance caring for themselves or someone else. Includes caregiver education, financial aid, legal services, and more. In general, Part A covers hospital care, home health visits, nursing facility stays. Part B covers medical equipment like wheelchairs, walkers, crutches, canes, oxygen tanks, etc. The parts of Medicare. Social Security enrolls you in Original Medicare, Part A and Part B. Medicare Part A, hospital insurance, helps pay for inpatient care in a hospital or limited time at a skilled nursing facility, following a hospital stay. Part A also pays for some home health care and hospice care. Medicare Part B, medical insurance, helps pay for services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Other parts of Medicare are run by private insurance companies that follow rules set by Medicare. Supplemental, Medigap, policies help pay Medicare out-of-pocket copayments, coinsurance, and deductible expenses. Medicare Advantage Plan, previously known as Part C, includes all benefits and services covered under Part A and Part B. Prescription drugs and additional benefits such as vision, hearing, and dental bundled together in one plan. Medicare Part D, Medicare prescription drug coverage, helps cover the cost of prescription drugs. Source: SSA.gov. Should I sign up for medical insurance, Part B? With our online application, you can sign up for Medicare Part A, hospital insurance, and Part B, medical insurance. Because you must pay a premium for Part B coverage, you can turn it down. If you're eligible at age 65, your initial enrollment period begins 3 months before your 65th birthday, includes the month you turn age 65, and ends 3 months after that birthday. If you choose not to enroll in Medicare Part B and then decide to do so later, your coverage could be delayed and you may have to pay a higher monthly premium for as long as you have Part B. Your monthly premium will go up 10% for each 12-month period you were eligible for Part B, but didn't sign up for it, unless you qualify for a special enrollment period. If you don't enroll in Medicare Part B during your initial enrollment period, you have another chance each year to sign up during a general enrollment period, from January 1st through March 31st. Your coverage begins on July 1st of the year you enroll. Read our Medicare publication for more information. If you have a health savings account, HSA, or health insurance based on current employment, You may want to ask your personnel office or insurance company how signing up for Medicare will affect you. Source: SSA.gov. How to apply online for just Medicare. Parts A and B? You can use this link to get started applying for just Medicare Parts A and B. It takes about 15 minutes to complete an online application. To learn more about other ways to apply for Medicare, visit www.medicare.gov/apply/. What is the cost of Medigap policies and how do they compare with other plans? What happens after I apply? Find out how to manage your benefits if you are enrolled in Medicare Part A and you want to enroll in Part B. Please complete Form CMS 40B. Application for enrollment in Medicare. Part B. If you are applying for Medicare Part B due to a loss of employment or group health coverage, you will also need to complete Form CMSL 564, Request for Employment Information. Go to Apply Online for Medicare Part B during a special enrollment period, and complete CMS 40B and CMSL 564. Fax or mail your CMS 40B CMSL 564 and secondary evidence to your local Social Security office. What happens after I apply? After you've applied for Medicare, we send an acknowledgement letter telling you whether your application was approved. We may ask you some questions about why you're applying for Medicare. The next step depends on what type of benefit you selected when you first signed up for Medicare. Medicare Supplement Plans. When you select this option, we start sending you letters asking if you'd like to continue paying into your supplement plans. Medicare in Idaho can be confusing. But don't worry, Chris Antrim insurance brokers are here to help you with the maze of finding a great Medigap, Medicare Advantage plan that fits your needs.